So we hear a lot jumping around to price transparency. So do you think, consumerism, that's the new trend, one of the other buzzwords besides value-based care, newer, I would say. So do you think price transparency, people knowing how much their visit's going to cost or imaging or anything like that, is that going to help reduce prices?
Right. So the first response to that has to do with what we talked about earlier, that a price without equivalent measures of quality is useless. They did a study in 2018 where they took this poor woman and sent her to 10 different MRI centers. And you hear all the time from the academics, oh, MRI is an MRI, so it's a commodity, so we should lower if your price is too high, you need to lower it. Well, it turns out that in half the cases, the diagnosis from these MRIs for the same patient were wrong. And another great example is Mayo. Walmart has a deal with Mayo. And in the literature, they talk about that they sent cancer patients that were diagnosed and treated in the local markets to Mayo. They found that 10% of those people didn't have cancer, and I think it was 40% that had the wrong diagnosis or treatment. So what is the cost of a wrong diagnosis and treatment? So this whole idea of price transparency is just bad. And what it's going to do is, if it drives prices down, it's going to force health systems to reduce their services. And what it will do is force physicians who are in short supply to stop taking Medicare and Medicaid and just concentrate on the better paying commercially insured patients. The other thing is this chart here. What this shows is that the top 5% of the population consumes about 51% of all healthcare dollars, and they spend about $61,000 a year. The top 10% consumes 86% of the healthcare dollars. And what's even more significant is the bottom 50% don't even consume 374.
It's negligible.
It's negligible, right. And the whole issue here is that the people that are consuming 80% of our healthcare dollars, they're not going to shop. They're in the system. They're going to be listening to their doctors. Our problem is we're not developing systems of care for these people. So if you have cancer, you're going to enter a system of care, or MS, a system of care, and that's something that we need to work on.